I am Dr. Monali Vakharia from the Medical Affairs team of Sun Pharma, and I will be your host today for today's episode. So, Love Your Eyes is this year's theme for World Sight Day, and on this occasion, we are here to discuss about some commonly asked questions, queries, do's and don'ts on glaucoma, which is one of the most common cause of preventable blindness. And to discuss this, we have a very renowned and expert panel with us. This panel will be moderated by Dr. Harsh Kumar. It is my pleasure to welcome Dr. Harsh Kumar in this episode. Welcome, sir.
Thank you.
Dr. Harsh Kumar is a very renowned and senior consultant from Center for Sight, New Delhi. For further discussions and introductions of our other panel members, I would now request Dr. Harsh Kumar, sir, to take over. Thank you, sir. Over to you.
Okay, thank you, Monali, and thank you, Sun Pharma, for having us here. I would just like to introduce our panel over here. Now, we have really an elite panel, but what is really elite about them is that all of them have dedicated their life to the work of glaucoma. And to begin with, there is Dr. Srishmitak. She is a professor at PGI Chandigarh, and her special interest is kids and glaucoma, but obviously she does everything, and she is a very, very good teacher and speaker. We also have Dr. Sunil Jain, who's an old-time friend from Bombay. He's running his own Iris Eye Clinic, which is also the glaucoma center over there. And he again is involved in a lot of glaucoma patient care and doing the most complicated glaucoma surgeries that you can imagine in a single hand setup. That is really, really very brave. We have Dr. Kavita, who comes from a prestigious institution, that is the Aravind Eye Hospital, and she's there in, basically she's heading the unit in Pondicherry. So she is blessed to be in a beautiful place. We also have Maneesh Singh, the young and the most rising and star of glaucoma department in overall. And he was working at multiple places in Calcutta, but primarily now he's working in Nethralaya. And all of these people also do cataracts, etc., but their primary interest is in glaucoma. So we would like all of them to tell us now. I'll keep asking them questions specifically about what glaucoma is, but let me introduce the thing that glaucoma is indeed a very serious disease. It is the commonest cause of irreversible blindness world over. And what it is also in Hindi called Kala Motia, Kaanch Bind, and so many other things, all trying to, and we are calling it the silent thief, something which just quietly takes your sight away without your knowing. By the time a man actually realizes that he has glaucoma, 50% of the people, 90% of the people have lost 50% sight. So which is hell of a thing to have. And so it's extremely serious. And if one catches it early, it is really great. So let's, and as far as figures are concerned, I think the easiest figure for you to understand is that every Indian above 40, 1 in 8 would either be having glaucoma or is a glaucoma suspect, somebody who can develop glaucoma. So let's jump in straight now, and let me ask Srishmita to explain to us what is glaucoma.
So glaucoma is something which we always consider the optic nerve, which is like a cable from the eye to the brain. And it's easy to understand that the eye is the camera and the brain is the CPU where your images are going to be seen. So the optic nerve essentially is damaged. So glaucoma is not equivalent to eye pressure. The eye pressure damages the optic nerve, yes, but you could have a damage at relatively lower pressure. So damage to the optic nerve in medical terms, it's called optic neuropathy due to probably pressure which is not enough for the health of that optic nerve. So remember that glaucoma is a disease of the nerve, of the optic nerve in your eye.
What are the risk factors for developing glaucoma, or who is likely to develop glaucoma? So, Srishmita, what tests would you do, or how will you explain to a general patient that if he comes over to us suspecting that he has glaucoma, how will we proceed as far as the tests are concerned? And suppose he is in a setup where money would be involved, how much do you think would be the money involved?
Okay, so the bare minimum checkup for glaucoma is, and it's important to understand, is clinical. So especially in a country like ours, like Dr. Sunil said, this angle closure disease is the one which is most commonly missed. And they do not necessarily come with always very high pressures in the emergency. It can be an insidious onset like the other glaucomas as well. So something called, so there's a slit lamp evaluation which we do on that machine. On that same machine, when the patient is sitting, we can take the pressure. We will be seeing the angle, which is called a gonioscopy, and we will be seeing the optic disc. Now, these three things are going to give us a fair idea of a suspicion of glaucoma. If it is obvious, we will tell him to go on and get his visual field, because the glaucoma impacts peripheral vision and he might be able to read all lines on the Snellen. So don't go away with the fact that I got my pressure or I got my vision checked last year and it was normal. I read all the lines. You can read all lines in glaucoma, unfortunately, until very, very advanced. But then the rest of your field of vision, what you have, the sides would be going, and ultimately you would lose central vision as well. So if we have the obvious glaucomas, probably just the bare minimum would be to monitor whether the whatever we do is okay, a feel, and a clinical examination on the slit lamp would be enough. If it is a very slight suspicion or there are other risk factors, say you have a strong family history and maybe you need steroids for, say, an asthma or something, but you seem normal today, then I would tell you that you need a baseline, which also includes other tests if it is affordable in a corporate hospital, or most government hospitals have things that are called the OCT, or they're called a disc picture, where your optic disc or nerve will be pictured. Those can come later, but the bare minimum would be a doctor looking at your eye and doing a visual field examination for glaucoma.
Thank you, Shushmita. I think you have beautifully brought out the fact that please don't worry. The tests, even in a corporate setup, are not expensive. And obviously, you can ask the doctor why each test is being done. And they will explain to you that, okay, I've taken the pressure, but the pressure may not always be high in glaucoma. So I will need to do a visual field, which is actually the spread of the vision on either side, which I think Sunil had already told you that if you close one eye and then you'll find that, okay, you cannot see fully. So if these tests are not able to tell, then like Shushmita said, we can go on to more expensive tests. But by and large, the tests are very, very simple. For the public, I want to tell you all that please, once you have got your tests done, please make a copy in a digital copy. Just take a photograph with your phone and send it to your email so that it is never ever lost. I am fed up of patients coming to us and telling us, oh, sorry, I lost my old records. In glaucoma, it is imperative to have the old records so all of us can see whether the thing is getting any worse on our treatment or not. So Manish, I think Manish and Sunil are in, I'm not asking Sunil, he's in Bombay, which is an expensive place. So let me check with Manish. What would be the costing to start? Would you do for that? You can see is not extremely, it is not, he is not a very middle average. Then what would you start with and how much would be the expense in a general setup for a single practitioner?
Exactly. So actually, sir, a lot of patients do have this concept that glaucoma treatment is very costly or detection is very costly, which is not the case, as Dr. Shushmita was mentioning. A comprehensive eye evaluation is actually what is required for most of the patient, and which means basically every patient who comes to the OPD should have a vision checkup, should have an eye pressure checkup, and checkup of the angle, and to dilate the eye and see the nerve properly. And most of these tests can be done in any OPD, any clinic. and you can detect glaucoma with this. If you think that the nerve is having problem, then you can do a side vision test or the OCT test, which Dr. Srishmitak was mentioning, where we see the thickness of the nerve. So for a general checkup, the cost in Calcutta will vary around say 300 to 500 or 700. As you were mentioning that compared to Bombay,
Yes,
we
that
have
is very
different
comforting
rates
to
in
hear.
Calcutta. So it's obviously city to city things do vary and also depends on the type of setup you're having. But around in Calcutta, mostly it's 300 to 700 range. You can have a complete eye checkup. Now, if there is a suspicion, then you may require further tests. So maybe a side vision test may cost you around 1,000 rupees. Some places maybe 500 to 1,000. OCT scan where you see the thickness of the nerve may cost you around 1 to 2,000. So if at max maybe 3 to 4,000 is enough if you do all the test also in a metro city like Calcutta to detect glaucoma. On how is you may require tests more frequently. If it is there is no glaucoma, you may just require once a yearly checkup. So then it depends on the case to case basis. But as I was telling you, what is more important is a complete eye checkup, which can be done in any clinic. And also from patient point of view, we have sometimes seen that patients get very restless. They don't want to finish their checkup in half an hour. They want to go, they are busy with their work. So a lot of time when we tell our patient that you need to dilate to see the nerve, they are not in a hurry. But then patient also need to understand to have a complete eye checkup. They need to spend 1 to 2 hours in the clinic so that they can be dilated and seen in totality.
Okay, so Kavita, in your setup, uh, obviously this is a very, very great charitable institution that you are representing, and Srishmita comes from a PGI which don't charge, I think, at all. And what is, do you think you people are charging something, or if Maneesh sends a patient to you, what will be the waiting time for that patient? Because many a times they are scared. I know for PGI, they may be, there may be a long waiting time. So what is the waiting time at your place for a glaucoma checkup to be done?
So, as you said rightly, this is the place where we have a lot of patient load, and the waiting time is the problem. Like when Manish was describing, like I was thinking about our charges here. Definitely, this is a charitable institute and it is nominal. Even for the paying side, the patients can have the entire complete glaucoma workup, including HFA, OCT, everything, like in around like $1,000. And also the waiting time is really a little difficult. The patient has to bear, so it takes at least I say like 3 to 4 hours the patient need to wait
No,
for the
days.
complete glaucoma.
I am saying days. Matlab, if he rings up your institution and says somebody has told me I have glaucoma, how many days after he'll get an appointment?
So we don't have an appointment system. We don't
Okay.
work on an appointment system. Any patient can drop
Yeah,
in
I understand.
any day.
So,
Yeah.
Shushmita, for you, what is the waiting time?
So where the costing is concerned, it's 10 rupees for a card, 10 rupees for, so if somebody says, go to the glaucoma clinic, it's 10 rupees for a file, it's 10 rupees for a refraction and 25 rupees for a field. We are of course free. So I think within 50 rupees, this thing is done. OCTs are free if we need. Coming to the waiting time, as Kavita said, now we are post-COVID. Thankfully, we are allowed to even say that you get an appointment. But when we get referrals, so if some doctor has referred as glaucoma referred to PGI, that means there's no question about him getting a waiting. He comes straight up to the clinic. He doesn't even go to the OPD. And all these things are probably done on the same day. Now, if a patient just walks in and says, I wonder if I have glaucoma, will you please look at me? He gets a waiting, he gets an appointment, which is now around 1 to 2 weeks. But when he gets the appointment, as far as possible, he goes off on the same day with a yes or no. At the most, he might get an appointment for a visual field because now the crowds are coming back. So that visual field appointment nowadays is about 2 weeks to a month. So it's
So he can go back to Manish and Sunil. So let's go back to them. So Sunil, if the patient is now finally diagnosed glaucoma,
Right.
and you want to sit down with him, and we'll talk about the treatment later, but what do's and don'ts you would tell to the patient that these are the things that you should do. These are the things you are now glaucoma. So please don't do these things. Please do the following.
I think that's that's the most important part. A good counseling session, especially for the first time patient, and also for the patient who comes to your opinion for the first time. And many a times I've seen that most of these patients are not aware of what disease they have. That is the very basic. When I ask them, do you know what is it? नहीं नहीं, हमको तो डॉक्टर ने बोला ये ड्रॉप डालना है, पूरे लाइफ डालना है, और हम डाल रहे हैं. अरे बीमारी क्या है? नहीं, वो हमको सब मालूम नहीं. आप हमको बोलो क्या करना है. So that's when first I have to sit down and explain them. The first is what is glaucoma. कि भाई आपका प्रेशर बढ़ गया है और उससे आपकी नस में दबाव आ रहा है. And then I have to tell them basically why you need a regular follow-up, why you need to put drops properly, and what is the essential the need for a follow-up. And that's when they realize actually it starts sinking in that how important it is for them to understand the disease. In addition, I also demonstrate to the patient's relative. Many times the patient's relative itself are not aware what the disease is, and especially more so elderly patients who are almost blind or having a tubular field. I demonstrate to them that what your mother or father is actually vision. I actually make them do a kind of a tubular kind of a field this thing. I tell the relative कि भाई आप अभी आपके आंख के सामने ऐसे करके देखो, and now you realize that what is your parent seeing, what is he going through, and what is the difficulty he's facing. So all that creates a good impact, and they become more acceptable to the treatment. That's what. And also I basically also tell them the importance of putting drops in time. Many times the patient कि भाई हम भूल जाते हैं. So I tell them, why don't you coordinate with some activity कि भाई आप सुबह चाय पी रहे तो उसके पहले ड्रॉप डाल दीजिए, या रात को खाना खा रहे उसके पहले ड्रॉप डाल दीजिए, तो आपकी भूलने की क्षमता कम हो जाएगी, या मोबाइल पे रिमाइंडर रख दीजिए. So these are small tricks you give them which they accept very well, and that improves the compliance of a patient.
Kavita, would you like to add something to this?
Yes, I would like to add few points there.
Do you have counselors, or is it that you are counseling with the type of load you have?
So we do counsel, especially when we see like non-compliant patient and we see patients for the first time. So what we do is like we first try to understand the patient. So patients who are like regular on their treatment and compliant, we just like ask the counselor to give the date and send them. And who's like not compliant, needs some counseling, we ask the counselors to show some videos so that they will understand better. And we also tend to spend more time with those sort of patients. Definitely here we have in Pondicherry, we have this Aurobindo ashram. So we have many of these patients from the ashram, like they present with a normal pressure glaucoma. So when we look into the history, like in their childhood, like at a younger age, they would have done these yogas, especially Sarvangasana and Sirsasana. If somebody has been diagnosed with glaucoma, so in our case record also, we have now included this yoga history also. And also we inquire about this driving. So especially with the yoga, we'll tell them to avoid all head down postures, which is tend to raise the intraocular pressure. And also in the history, we'll try to get about their driving, and depending upon the visual field damage, we do counsel them like the difficulties they might face during the driving. And also like we'll counsel about the family history and the family screening. We give importance to that and tell the patients to come. And also more than all these things, like before we start the treatment, is very important to understand the systemic medications the patient is having. So most of the time the patients feel that that is a different disease. We need not reveal that to the eye doctor. So sometimes there are certain drugs like beta blockers, which is like contraindicated in patients with breathing disorders, asthma. And when we will keep on giving, the patient might be going for the treatment for asthma to somebody else. So it's very important to ask them, to make them understand, and we have to make them tell like the drugs they are on and the systemic illness they have. And also like in low pressure glaucomas, we do inquire about their sleep disturbances and also their hypertension history. Like we need to get and ask them to avoid taking the antihypertensives, especially at late night, which tend to reduce the blood supply to the optic nerve. So we tend to ask about these things and counsel about the other conditions.
I think that was very good. I think between the two of them, they've literally covered everything. Just one or two points I want to
So
add. Water drinking test, again, a lot of people
Yeah.
are drinking too much water in the morning,
Water.
again, because of the yoga business. So yoga is very good, but I tell them stop everything which is head posture down, like you rightly said. So you have to name out the, because, and then they say, okay, can we do pranayam and Kapal Bharti, which is again absolutely contraindicated. So I tell them nothing except meditation and lots of walking.
Okay.
And so you have to tell them that, okay, aerobic exercises are good. You can do walking, cycling, jogging, running, that all lowers the pressure. And please, you have to tell them that no tobacco, because so many
Yes.
people have put them off tobacco, because a lot of people are taking tobacco, and at least we don't want that. At least there's for at least the meditation and tobacco, whether there's actually any improvement, but at least there's a perceptual improvement in the rest of the life. So we'll be much, much happier. And please, they have to be told, every patient must understand that after they put the drop, they have to close their eyes for 2 minutes and press it at a specific point, which we explain to them, so that the drop does not go into the throat and doesn't get absorbed in the body. So all these things are to be taught to the patient, and then also that only a single drop is to be put. All those things are important.
Thank you, panelists and our moderator, for guiding us on some commonly asked questions and related topics. It was a very simplified and systematic guidance for us. For the viewers, with the world fastly moving towards increasing use of digital devices and with the changing lifestyle, it is critical for us to be aware about. Hope these discussions would have helped you to understand its signs, symptoms, how to manage it, and what are the risk factors and what symptoms or warnings you should look for. For any further queries, you can further consult your ophthalmologist or eye doctor.